I'm Adam Clemens, Ohio Northern University student and possible MedMicro flunky. On this episode of Disease 101, we're going to be covering polio, caused by the polio virus. This virus has a polyhedral capsule and it is a single-stranded positive RNA. We're on the prowl here on campus to look for some college students to ask what they know about polio disease.
Do you know how the polio is transmitted?
I do not. Hey, Dr. Anderson, do you know how the polio virus is transmitted from person to person?
Well, I certainly do. Polio is carried by asymptomatic carriers and is generally transmitted from person to person via the fecal-oral route. The pathogen can live up to several weeks in a person's fecal matter outside the body, raising the risk of transmission from food, water, and everyday objects. I know the food is safe here. My wife makes sure.
Awesome.
Excuse me, gentlemen, may I ask you a question real quick? Sure. Do you know how the polio virus enters its host?
No.
Exactly what I thought. Thank you. Excuse me, ma'am, if I may ask you. Now, do you know how polio enters the host, aka someone like yourself experiencing paralysis?
Side note, did you know Candyland was created for children with polio?
Excuse me, do you know how the polio virus enters its host?
The polio virus enters via ingestion of fecal matter through fecally contaminated food, water, and objects.
Wow.
Excuse me, ma'am. Do you know how the polio virus attaches to its host?
No.
Honesty, I love it. Next.
So, can you tell me anything about the attachment of the polio virus?
Well, the virus attaches to the cell of the oropharynx and it replicates in the swallow with saliva. And then it replicates in the cells of the intestines.
Alright, so how does the polio virus overcome or avoid the host?
I have no idea.
Exactly, no one does.
Excuse me, do you know how the polio virus avoids and overcomes its host cell defense?
Actually, I think I do know that. The polio virus is a stable virus and it's stable under acidic conditions, so it can go through the stomach. It also is an intracellular pathogen that initially restricts infection in the epithelium, avoiding circulating antibodies and the immune system.
Hello, Disease 101.
Yeah?
Hey, Shivani, how you doing today?
Good, I guess.
Good?
Yeah.
All right, I got a question for you. Do you know how polio damages your body?
No.
Disappointment.
Do you know how the polio virus damages its host?
Yeah. The primary infection leads to viremia, which are viruses circulating in the blood. The virus can spread to attack nerve fibers and attach to neurons, especially those of the anterior horn cells of the spinal cords. The virus can then replicate in the motor neurons, spreading to the skeletal muscles. This leads to the destruction and they do not regenerate.
All right, we're here by the wishing well, hopefully wishing that someone knows the answer to this next question. We're on the prowl, let's go. Excuse me, you, ma'am, may I ask you a question?
Sure.
Disease 101. Do you know how polio exits its host?
Nope.
All right, you can exit the premises, please. Thank you. Let's go.
In here at the law library, this is a law student, very smart to get into the program here at ONU. I bet she'll know. Excuse me, ma'am. Do you know how the polio virus exits the host?
No.
Even our justice system fails us today.
I'm going to ask you a question, okay?
Okay.
Do you know how the polio virus exits the body?
The polio virus exits the body through the host feces.
That's not a load of crap.
Well, it's obviously these students don't know anything about polio. They need to study up on their MedMicro. So instead of hopelessly asking them questions, how about I go ahead and give you a little bit more information from these scripted lines. And now, some fun facts about polio. Did you know that over 95% of the polio virus infections are only asymptomatic? Roughly 4% cause a fever and an illness without the central nervous system involvement. Less than 1% of these infections actually cause paralysis, which many recover from this. This virus is biphasic, which means that the first phase includes a fever, malaise, headache, sore throat, and vomiting. Viral meningitis symptoms, such as fever, headache, a stiff neck, maybe some vomiting, and possible paralysis, occur after 3 or 4 days. To learn more about this diagnosis and the disease and treatments possible, we have our special guest, Dr. McKenna Brockman. Oh, my bad. How you doing today, McKenna?
Pretty good. How
Pretty
about you?
good. Not too bad, not too bad. Hopefully gonna learn a thing or two. All right, McKenna, can you tell us, how do you diagnose the polio virus?
Yes, to diagnose this disease, a specimen needs to be taken from either feces, the spinal cord, or from a throat. And then you check this with an abnormal DNA test for infection, and you take that from the species that you collect.
Wow, that's a mouthful. If the test was to come back positive, what would this mean? What would you suggest as a treatment for polio? Is there hope for these people?
Unfortunately, there is no antiviral agent available to help treatment. So you just treat these patients for their symptoms that are occurring, such as maybe pain relievers or portable ventilators to help with their breathing. Also, you may help with their physical therapy for abnormalities in their legs or give them leg splints.
My goodness, that's a mouthful. How do you know all this? All right, after going through how you diagnose it and some of the treatment, is there any way to prevent this disease, McKenna?
Actually, there is a good way to prevent this disease. In 1961, Albert Sabin's live vaccine became the standard for prevention of polio. It's a low-cost vaccine that can be delivered orally and provides mucosal immunity. It is labeled as the oral polio virus. There is also a second polio virus vaccine, which is called the inactivated polio vaccine. This vaccine provides serum immunity and is recommended for children to receive in 4 doses. The first dose is at the age of 2 months, then at 4 months, then at 6 to 18 months, and then at 6 to 8 years old. Polio can also be prevented by washing your hands after using the bathroom and disinfecting household items that may be infected.
That was another mouthful. I don't know how you know so much, but thank you very much for coming and sharing us with us today. I know I'm going to have to go study some more MedMicro to make myself aware of the diseases out there. Disease 101, signing off.